level up your skills with the RSNA Imaging AI Certificate Program, where case based courses equip you for the future. Master the fundamentals, dive deeper with advanced topics, or obtain a diagnostic edge to meet those high demand moments. Gain confidence, efficiency, and career advancement in this rapidly evolving field. Not sure where to begin? Take the quiz at rsna.org/AI-certificate.
Hello, and welcome to the RSNA Radiographics Podcast. My name is Jennifer Weaver, and I'm a musculoskeletal radiologist at the University of Texas, San Antonio. I'm here with Jonathan Revels, a chest and body imager in the Department of Radiology at New York University. Our episode today is being recorded at the RSNA 2024 meeting in Chicago, Illinois.
Our guests for today's podcast are Lakshmi Ananthakrishnan, a body radiologist at UT Southwestern, and Fides Schwartz, a research radiologist at the Brigham and Women's Hospital in Boston. Both are co-authors of Getting Started with Photon-Counting CT, Lessons Learned. Welcome to both of you.
Thank you so much for having us. We're excited to be here.
Photon-counting CT technology only recently became available clinically in the U.S. Can you tell us a little about the distinctions between photon-counting CT and energy integrating detector-based CT?
Yes, absolutely. As the names say, the difference between the two technologies lies in the detector. Energy integrating detectors are scintillators. They transform incoming photons into light and then turn the light into an electrical signal that is then used to make an image. CT scanners have used energy integrating detectors for years. Photon counting detectors are different because they skip the scintillation step. This is a big deal for a few different reasons. First of all, photon counting detectors can separate the individual incoming photons based on their energy levels and produce a proportional electrical signal. This allows for the extraction of spectral or multi-energy information at the detector level. Second of all, since there is no scintillation step, no physical septa are needed inside the photon counting detector. This allows photon counting detectors to have smaller detector elements, which allow for increased spatial resolution of photon counting CT.
So what are the main challenges of establishing photon counting CT into clinical practice?
Well, whenever a new CT scanner is installed, you have a big CT team of radiologists, medical physicists, technologists that all work together to optimize images as well as optimize the radiation dose. Photon counting CT has a lot of really cool benefits, but it is new for everyone on the CT team, and it can get overwhelming. One big challenge is simply becoming familiar with the terminology used by the photon counting CT detector and the scanner. Photon counting CT has benefits that can be leveraged in different ways, such as improving your radiation dose efficiency or using ultra-high resolution imaging. But in order to actually set up your scanner protocols to leverage those benefits, you got to know the lingo so you know what settings to tweak. This is actually a big reason that we wrote this paper. We wanted to make it easier for others to add photon counting CT into their practice.
Interesting. Can you explain a little bit about the physics of photon counting CT?
Yes, our pleasure. So the physics of photon counting CT is based in the difference in the detector setup, as we talked to just above. And the semiconductors used in photon counting CT are either made from a material with a high atomic number, like cadmium telluride, which is used in the currently clinically available models, or, and this is still in the prototype stage, material with a low atomic number like silicon. And let's use an example here where you have two different photons of different energies, for example, 40 and 100 keV photons hitting a detector. In an energy integrating detector, this detector will just add the two together, so 40 plus 100, and create a single detector output with a signal proportional to 140 keV. But with photon counting detectors, the detector output will be two separate signals where you have 40 and 100 keV. Why does this matter? Well, this means that spectral information is always available. You can then use that information, material decomposition images like iodine maps and calcium maps, or low and high monoenergetic reconstructions.
Also, let's talk about image contrast for a minute. Let's go back to that same example where we have a 40 keV photon and a 100 keV photon hitting the detector. That 40 keV photon contains more information related to image contrast because it's closer to the K edge of iodine. But when those two photons hit an energy integrating detector, the readout is just that single signal that is proportional to 140 keV. So even that 40 keV photon is one of two photons hitting the detector, it only contributes less than a third of the total 140 keV output signal. So in other words, that important image contrast information held in that 40 keV photon just got downweighted big time. How is that photon counting detector different? Well, that photon counting detector can actually discriminate those 40 and 100 keV photons apart from each other, which means that the image contrast information held in that 40 keV photon is now equally weighted compared to that 100 keV photon. This is how photon counting CT can have improved image contrast compared to energy integrating detector CT. So this is a really big development in CT detector technology.
Yes, and so in summary, photon counting CT gets you better contrast resolution for your image because it is more equally weighing the low energy photons. And then it also gets you the added bonus of spectral information for all of the scans because it can discriminate the energy strength of each photon it detects.
Oh, that's really cool. Now, what are some of the important factors that should be considered when building protocols for photon counting CT?
There are a lot of dials and knobs on the scanner that you can turn while you're building protocols. This means that you can do a lot of cool stuff, but it can also be very overwhelming to a new user. Whether you're a technologist, a physicist, or a radiologist who might be less familiar with some of the terms used on the actual scanner hardware. We go through many of these parameters in the paper to try to help readers understand the different parameters that can affect image quality. These include parameters like the scan mode, image quality levels, reconstruction kernels, and iterative reconstruction strengths.
And also photon counting CT allows you to remove electronic noise from the image. What does this mean? The electronics associated with a regular energy integrating detector have some noise associated with them. That translates to a low level of noise on the image. Photon counting CT's ability to tell each different photon energy apart also allows it to say, well, I'm only including photons that are, say, 30 keV strength and higher into my image. This is important because any signal less than 30 keV threshold are attributed to electronic noise rather than real signal. And then photon counting CT can simply ignore that signal attributed to electronic noise, leading to a less noisy image for all of your images. Why does this matter in protocol building? Well, you can leverage this ability to eliminate electronic noise while you set up your protocols. You can use that decreased image noise to either create a prettier, less noisy image, or decrease your radiation dose and have an image with noise levels similar to your energy integrating detector CT image with less radiation dose.
So what are some of the things that radiologists in your group need to know when they open up a photon counting CT? How is reading a photon counting CT really different than reading a regular CT for the average radiologist?
Great question. I think a really important question to whenever you're adopting a new technology. A big difference is simply the type of image that you're actually reading off of. Virtual monoenergetic images are datasets that many listeners who are familiar with dual energy CT might have heard of. These are images that simulate what the CT image would look like if it were imaged using a monoenergetic X-ray beam instead of a 120 or 140 kVp polyenergetic X-ray beam. For the photon counting CT scanner that is currently available on the market, the standard type of image that the radiologist reads off of is a virtual monoenergetic image. When building protocols, the scanner also has a preferred output depending on what kind of CT you're doing. For example, for a CT angiogram, the scanner optimizes the images, assuming that the radiologist will read off of a 55 keV reconstruction. This makes sense because the vasculature will look much brighter on a low keV reconstruction like 55. 55 keV makes iodine look brighter on the image. But this means that for the radiologists, those 55 keV recons will look way brighter than a typical 120 kVp image that they're used to reading off of. This is a learning curve for radiologists as the images often just look a little bit different. I'm an abdominal radiologist and I'm used to using my keyboard presets for soft tissue and liver windows. But these presets are designed for a 120 kVp polychromatic image. One thing we suggest is just making sure your colleagues understand why your photon counting CT images look different from the other CTs, but that they may need to adjust the windowing a little bit. Just knowing that you need to adjust the windows will help your radiologists be more satisfied with the images and just know what they're looking at.
Yes, and the same concept goes for other settings on a photon counting CT scanner as well, such as the reconstruction kernels and iterative reconstruction strengths. These can be optimized in different ways depending on the clinical task you're trying to perform. For example, looking at bony detail versus optimizing the images for radiation dose reduction. But you want to make sure that the radiologists in your division have a basic understanding of why the photon counting CT images look a little different. In our experience, if radiologists understand the why, lower radiation dose or better spatial resolution, whatever the benefit is, they are much more accepting of images with a slightly different look to them.
So, follow-up question on the same thread is, what types of post-processing need to occur with photon counting CT?
Yeah, so this is mostly up to the individual department to decide. It is possible to simply send the same series that everyone is used to from prior scanner models and receive the same or slightly improved quality. This doesn't take advantage of the capabilities of photon counting CT, though. So sending iodine maps automatically, for example, is an option that we use for abdominal imaging, and so are lower KEV reconstructions for specific vascular protocols. These settings can be automated, so techs at the scanner don't need to spend extra time on them.
Thanks for explaining all those differences. Are there any other ways that image interpretation differs for photon counting CT compared to conventional CT?
A lot of interpretation tasks can be handled more speedily with data from photon counting CT compared to older scanners. For example, if I can see really minute detail of how a tumor is invading surrounding vasculature, that can help surgical planning. Now, it should be noted that depending on what the goal is, you might have additional series or images to review. I do believe that this is mostly beneficial, especially if it leads to not having to recommend additional imaging, like recommending an MRI.
And one thing we haven't talked about yet is the spatial resolution. The spatial resolution you can get with photon counting CT is pretty amazing. You can get excellent resolution of small structures like the temporal bone and coronary vessels, especially when using the ultra-high resolution mode of the scanner. But one important thing to remember is that better spatial resolution comes with more images. When setting up your scanner, you should think about when you really need that improved spatial resolution. Radiologists are really busy, and you want to use that improved spatial resolution when it will really benefit the patient, but not send extra images where you don't need them. Older PACS systems can also get bogged down by a ton of extra images, so that's also something to think about when you're setting up your scanner. You need to make sure that your PACS can handle the network and storage need of these increased data sets.
What do you see as the future for photon counting CT? Any special indications for MSK imaging?
So for MSK imaging, especially ultra-high spatial resolution may be helpful in evaluating fracture healing, for example. And then things like calcium and gout maps should be available soon after FDA approval.
Now, being at RSNA, I think I already know the answer to my question, but are there any special indications for cardiac usage?
Well, that's one of the areas where there's been a lot of literature that has been focused on this because the coronary vasculature is so small. And I think people with pre-existing stents could routinely be imaged on photon counting CT scanners, as the higher spatial resolution aids in the reduction of blooming artifacts from stent struts and makes the evaluation of amount of in-stent thrombosis more reliable. The scan speed is as high as with the fastest prior generation scanner, so this is great for cardiac CT patients. One thing to think about is that patients with very irregular heartbeat might benefit from a different scanner system, as the currently available photon counting CT is limited to retrospective acquisition.
So on the whole, taking all comers, what patient populations do you think benefit the most from photon counting CT?
Great question. And I think it's a really exciting topic because new literature is literally coming out every month on the various benefits in different patient populations. The dose reduction offered by photon counting CT, I think, will be really amazing for pediatric patients. And also patients of larger body habitus can sometimes be hard to image with regular CT. And image quality can be improved with photon counting CT. We actually have an example in the paper of using low KEV imaging to get improved image contrast on CT pulmonary angiograms with photon-counting CT.
And then, for example, temporal bone imaging is exquisite with photon-counting CT. And this is a relatively niche application, but patients with spontaneous intracranial hypotension that are suspected to have a CSF to venous fistula have already been shown to benefit significantly from imaging on photon-counting CT, as these studies truly need the ultra-high resolution of 0.2 millimeters to show the minute connections between the CSF and venous system. This then allows for targeted therapy, which is more successful than non-targeted blood patches for most of these patients.
This has been a great introduction into photon counting CT. I think we're going to be learning more and more about this as the time advances. So thank you both for coming and talking with us today. And thank you both and your co-authors for this really lovely paper. And I encourage everyone to check out their many images and detailed article online, especially if you're just starting to use photon counting CT. And thank you all for joining us today.